Good afternoon, everyone. Today is Wednesday, December the 16th, 2020. We are in week 41 of the COVID pandemic here in Montgomery County. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, here with my colleague, Commissioner Ken Lawrence, and welcome to our Wednesday afternoon press briefing. As we continue to navigate this very challenging situation, I want to emphasize that we are all in this together. The choices that each of us makes regarding our personal conduct, whether or not we wear a mask, attend private social gatherings over the holidays, or answer the phone when a contact tracer calls, impact our entire community. Our Montgomery County hospitals continue to have more patients hospitalized with COVID-19 now than they did in the spring. While the hospitals are better equipped with PPE, ventilators, and medications that can ease the course of the disease, they all continue to face critical limits in the number of staff they have available to care for patients. All of our hospitals have been impacted by staff who have been exposed or infected in the community due to the substantial amount of virus circulating right now. Our hospitals are going to extraordinary lengths to properly and safely staff the beds that are currently open. We need to work together as a community to reduce the spread of virus in our community to protect our hospital staff. I want to share with you again the visual comparison of your chances of running into someone with COVID-19 on June the 26th, the day we entered the green phase and the day that we were at our lowest 14-day average, compared with today, December the 16th. On June the 26th, we had 443 cases in the past 2 weeks. If we divide this number by the county population of 830,915, we get 0.053%. Expressed as a fraction, this is 1 in 1,875. In other words, you would encounter one positive case for every 1,875 people you interacted with. Today, things are much different. For the 14 days prior to December the 16th, we had 6,479 cases. Using this same math, you would likely encounter a positive individual for every 128 people you interact with. You are more likely this week to encounter someone with COVID-19 than last week, when the odds were 1 in 155. This graphic only shows PCR confirmed positive cases and does not account for the asymptomatic but COVID-19 infected individuals who are in our community. Each of us has the power to improve this situation by making choices that will reduce the spread of the coronavirus. Please keep the following facts in mind. The CDC has determined that over 50% of transmission of the coronavirus is by people with no symptoms. The virus is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Multi-layer cloth masks that do not have a valve can block 50 to 70% of these respiratory droplets. Cloth masks do prevent transmission of the coronavirus. Consistently wearing cloth masks and maintaining 6 feet of distance from anyone who is not part of your household, whether you're indoors or outdoors, will have a big impact on reducing spread, protecting you, and protecting your family. Avoid social gatherings with people outside of your home. If you can work at home, please do. Avoid carpools if possible. If you can't, each person should wear a mask and the window should be open for the entire drive. Keep your hands clean and away from your face. Get tested if you need to or want to, particularly if you're thinking about traveling or have returned from travel. And cooperate with contact tracing if you get called. Since our December 15th press release, we have 378 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 27,864. These positive cases are a result of a positive test for the virus, not from the antibody test. 27 are from long-term care facilities, 15 are from the Montgomery County Correctional Facility, 330 are from the community, and 6 are from other congregate settings. 356 of these tests are from the past 7 days or less. 14 tests are from 8 to 14 days ago, and 8 of these tests are from more than 14 days ago. These positive individuals are from 51 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 4 days old to 99 years old. And as always, you can check our county maps at moncopa.org/COVID-19 for updated geographic information. Today, we have 179 females and 199 males. I am sorry to confirm that one additional Montgomery County resident has lost their life to COVID-19, which brings us to 942 deaths confirmed positive from COVID-19. This is an increase of 34 deaths since last Wednesday's press briefing. In the last 24 hours, the one individual that passed away did pass away in a hospital and was 72 years old. Overall, we've lost 492 females and 450 males who ranged in age from 34 years old to 104 years old. As you know, we've been tracking the racial breakdown as self-reported by that individual or their family when we're able to obtain it. Currently, we have one individual of American Indian or Alaska Native descent, 24 Asian, 5 Asian Indian, 4 Asian Korean, 115 African American or Black, 417 white, and 376 unknown. And a quick update on the correctional facility. Since September, we have routinely had new commits to the Montgomery County Correctional Facility who tested positive for COVID-19. These individuals go through a strict isolation protocol before being moved into the general population. In the last week, the Montgomery County Correctional Facility has had a number of staff and individuals in the general inmate population test positive for COVID-19. The last mass testing of the inmates and staff took place on September 3rd and 4th. All of those tests came back negative, and there have been no inmates in the general population with symptoms or positive tests for COVID-19 since then. Tomorrow, or until these cases recently. Tomorrow and Friday, the 4th round of facility-wide testing for COVID-19 will be conducted. All staff and inmates will be tested tomorrow and Friday. Currently, all inmates who have tested positive for COVID-19 are in isolation and are stable. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 794 today, a net decrease of 548 individuals, which is a 41% decrease. Moving on to our positivity rate. Our positivity rate has ticked upward again this week. Our 14-day average positivity rate is 11.1% as of Friday, December the 11th, compared with 9.73% as of Friday, December the 4th. And just as a reminder on this graph, the orange jaggedy line is the number of people who were tested each day who live in Montgomery County, and these are all PCR tests. And then the blue line is the 14-day average PCR positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. This graph shows the daily positivity rates from November the 28th to December the 11th, and shows that the county has been above that 5% as indicated by the red line on all 14 of these days. As mentioned earlier, our hospitalizations continue to remain high. Today, 537 individuals with COVID-19 are hospitalized in a Montgomery County hospital, basically unchanged from last week. 10% or 55 of these individuals are requiring a ventilator. And as a reminder, we have this information on daily hospitalizations and ventilator use on our data hub at moncopa.org/COVID-19. ccc.org/COVID-19. We continue to have good testing in the county. For the 14-day period ended December the 11th, 62,205 Montgomery County residents were tested, which is an increase of 4,500 people tested compared with the 14-day period ending December the 4th. This is our date tested graph. As a reminder, the gray bars show the number of positive cases on the given day. The red is the total 7-day average. The pink is the total 14-day average. The dark blue is the 7-day average from the community. The light blue is the 14-day average from the community. And way down at the bottom, the orange and the yellow are the long-term care 7-day and 14-day averages. Next, we'll zoom in and remind you of the impact of the Halloween and Thanksgiving holidays, during which there were many private social gatherings. You can see the uptick following Halloween. Then just as that surge started to level off, it was the Thanksgiving holiday weekend. We've been experiencing an unprecedented surge in cases since Thanksgiving, but are hopeful that we're starting to level off, and hopefully we will begin to trend downward. As you make plans for the upcoming Christmas and New Year's holidays, please consider the impact that the Halloween and Thanksgiving holidays have had on our community. The safest strategy is to celebrate only with the people in your household. I do want to remind you, as we go through yet another set of holidays with lots of sacrifice and missing lots of friends and family, that there is light at the end of the tunnel. Vaccine will be arriving at 8 of our 9 Montgomery County hospitals this week and at our 9th hospital next week. This vaccine will be used to vaccinate frontline hospital workers, but none of our hospitals are getting enough vaccine with this first delivery to vaccinate all of their workers. They are having to make priority lists even within each hospital. We do not have a date certain as to when our hospitals will receive additional vaccine or how many doses. We also expect that CVS and Walgreens will be receiving doses in the very near future that will be used to vaccinate residents and staff in long-term care facilities in Montgomery County. Once the hospital workers and long-term care facility residents are vaccinated, the next batch of vaccine will go to essential workers like EMTs and paramedics, grocery store workers, pharmacy workers, hopefully teachers and other essential members of our community. In a few short months, there will be safe and effective vaccine available for our community at large, but we need to hunker down between now and then in order to protect our hospitals and first responders, to protect the teachers and staff and school bus drivers working in the districts whose elected school boards choose to offer in-person education, and to support those businesses that are operating safely, are following all the mitigation measures, and that are not known sites of COVID transmission. We want them to continue to be able to continue to operate. Update on our contact tracing. Due to the large volume of cases, the contact tracing team continues to prioritize contact tracing in the following way. This prioritization is aligned with guidance from the Pennsylvania Department of Health. Persons 18 years of age and younger, and that is an effort to also help support our schools. Persons 65 years of age or older, and persons who are part of a community or household cluster. Also, if you were exposed at a school, through a sports team, or at your workplace and you need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. So if you believe you've been exposed through one of these locations, please check your email regularly. We continue to have good availability of testing. I want to urge anyone who wants or needs to be tested to get tested. Please note that because of the impending storm, all of our county test sites will be closed tomorrow, Thursday, December the 17th, but testing will resume on Friday, December the 18th, for regular testing hours of 9 a.m. to 5 p.m. This Saturday, December the 19th, COVID-19 testing will be available in Norristown at our regular testing site in the parking lot of the Norristown Regional Health Center, located at 1401 DeKalb Street in Norristown from 9 a.m. to 1 p.m. That's this Saturday. Online appointment registration will open for this site starting at 7 p.m. Friday night. At 7 p.m. this Friday night for testing in Norristown Saturday morning. And you can start making an appointment Friday night at 7 p.m. at www.montco.org/COVID-19. Click on the County Testing Information button at the top of the page. We're also pleased to announce that starting next week, on December the 21st, 2 of our testing sites will shift their operating hours to accommodate later appointment times. Our Pottstown and Ardmore locations will offer testing from 10 a.m. to 6 p.m. 2 days a week. Pottstown will offer this on Mondays and Wednesdays, again 10 a.m. to 6 p.m. And then Tuesday, Thursday, and Friday, they'll be at 9 to 5. And in Ardmore, they will offer on Tuesdays and Thursdays testing from 10 to 6 p.m. And then Monday, Wednesday, Friday, they'll be 9 to 5. Our hospitals continue to ask us to remind the community that hospital emergency rooms are not to be used for regular COVID testing. Please use a county testing site or one of the many private sites in the county. They want the hospital emergency rooms to be available for people who are sick or experiencing a medical emergency, not for routine testing. If you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait 5 days from the time of the exposure. Getting tested more quickly than 5 days will not be reliable. If you test negative after 5 days, have not had any symptoms, and have not had any ongoing exposure to someone with COVID-19, then your quarantine ends on the 8th day after exposure. Just also want to remind everyone that to register for a test, you can go online every morning at 7 a.m. at www.montco.org/COVID-19 under the green County Testing Information button. Those appointments open at 7 a.m. on the day of testing, not at 6:59. If you go on then, it will say the sites are closed. It will open at 7 a.m. just for that day. You cannot book ahead. You can also make appointments by phone, and that starts at 8:30 in the morning. That phone number is 610-970-2937, and we do have language lines available at that phone number. So just remember that we continue to be in a very serious and rapidly evolving situation. We, working together, suppressed this virus in the spring, and I know that we can do it again right now. We're starting to see signs that our numbers have plateaued from Thanksgiving and are beginning a downward trend. And my most sincere hope is that we can keep this downward trend going through the holidays and not see yet another spike after Christmas or New Year's. So please, please act accordingly. It is really so important for our entire community, for our hospitals, for our schools, all the people that are trying to make this work and be safe. So please just think twice before you do something that would increase your chances or your family's chances of being exposed to COVID-19. I know if we stand together, we can absolutely beat this thing. We just have to get through a couple more months until there's more vaccine available for all of us. And with that, I will turn over to Commissioner Ken Lawrence.
All right, thank you, Val. First, I'd like to share some news for our restaurant and food service industry that we know are struggling right now with the recent shutdown. We recognize the importance of this industry as a cornerstone of Montgomery County's economic and workforce development, as well as central to the growth of entrepreneurship, job opportunities, and our communities. I just want to remind everyone, to date, we have awarded nearly $20 million in CARES funding to Monco businesses and nonprofits struggling due to the impacts of COVID-19. So I'm proud to announce today that the Board of Commissioners is making available an additional $5 million in county economic development funds to support restaurants and other food service businesses as we move through the next phase of the COVID-19 pandemic. Applications for the Monco Strong 2021 Restaurant Grant Program will open on Wednesday, December 30th and close on Wednesday, January 6th, 2021. More information will be shared on our website later today. Grant awards for each qualifying business will be $10,000, and this program is jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. So we encourage restaurants and other food services businesses in need of support to look into this latest round of funding and apply. Our Commerce Department will be available to assist anyone with questions. And more information will be found later at moncopa.org//.commerce, moncopa.org/commerce. We know that people are dealing with months of adhering to CDC guidelines and physically distancing from neighbors, friends, and family members outside of our households to reduce the spread of COVID-19. And we know that this is taking an emotional toll. No handshakes, no hugs, no gatherings. Our new normal doesn't feel so normal. And as a result, many of us are experiencing a greater sense of isolation and loneliness. And adding to our concerns is the fear of becoming infected, the economic fallout, and inconsistent messaging about the virus and when this pandemic may end, even in light of the new vaccines. And we know the holiday season alone can exacerbate negative emotions and triggers. We want our residents to know that we care about you and that there are several resources for you and your family members or friends if you are struggling emotionally or in crisis. The state of Pennsylvania has a mental health support line, warm line, which will connect you with a free crisis counselor and can be reached toll free at 855-284-2494. And the Montgomery County Mobile Crisis Support is also available 24/7 for anyone experiencing depression or suicidal thoughts, and also provides peer and teen support services. You can call 855-634-4673 toll free, or visit www.accessservices.org for more information. So while we are asking everyone to physically distance from individuals outside of their household, remember that you can stay in touch with friends and loved ones in safer ways, whether it's Zoom, FaceTime, Skype, or just a plain old phone call. Please reach out to someone, especially during the holiday season, and check in and see how they are doing. I'd like to share one of our great community partners is Mission Kids Child Advocacy Center. And they wanted us to share to remind everyone to keep an extra eye out for our kids, especially during the holiday season. Many of our children are not in school, so many mandated reporters and trusted adults have lost their eyes on kids. So child abuse reports are down, which sounds like it's good news. But even with fewer reports, Mission Kids has seen an 8% increase in the number of children being abused by family members when they are left at home alone as a result of COVID-related school modifications, illness, or unemployment. If you suspect that a child is being abused, please call Childline, our toll-free child abuse hotline at 1-800-932-0313, 1-800-932-0313, which is available 24/7 and where you can report anonymously. Mission Kids achieves healing and justice for alleged victims of sexual and physical child abuse by providing collaborative services, advocacy, leadership, and education. They work closely with our county's Office of Children and Youth to provide neutral, fact-finding forensics interviews and support Montgomery County's multidisciplinary team approach to child abuse investigation and intervention. It's all of our responsibilities, every adult, to stop child abuse. So please help us and use those numbers if you suspect that a child is being abused. temperature has dropped and there is literally snow on the ground. Winter is here. And we recognize that many in our community who struggle to find adequate food, among other things, this is a very tough time of year for them. And this year, due to the COVID-19, the need is greater than ever, and demands on safety net organizations have skyrocketed. According to a 2018 Feeding America study, 9.5% of Montgomery County residents are food insecure, and 12% of those residents are children. Over 51,000 residents are receiving benefits from the Supplemental Nutrition Program SNAP. But due to COVID, we know that these numbers have grown. So far this year, the 34 Monco Anti-Hunger Network member food pantries have seen an increase in volume, in some cases double or triple, especially when non-essential businesses were shut down in the spring. The recovery from the COVID-19 pandemic, along with the economic consequences, could take years, putting an even greater stress on these resources. So we need your help to find these vulnerable families, individuals, seniors, and children enough nutritious food to eat during the harsh weather months. Here's what you can do. You can make monetary donations toward food online or by check to the Monco Anti-Hunger Network. They will use the money to purchase food for local pantries. And you can visit www.moncoantihunger.org for more information. And you can volunteer to provide meal deliveries and stock food pantries through RSVP by calling 610-834-1040. All food providers are practicing heightened hygiene practices such as staying home when sick, modifying routes to use fewer volunteers, and providing frozen meals. And finally, I want to put in a plug for Ready Monco and Ready Radio, as we do have inclement weather. We are continuing our efforts to keep both the public as well as our public, private, and nonprofit partners well informed. So I want to remind people of a couple of ways to get the most up-to-date information. Ready Monco is the most direct way of receiving official county information during any emergency. You can register for free at www.readymonco.org, and you can choose how you want to receive alerts by phone, text, or email. And Ready Radio is our Department of Public Safety's Ready Radio network. It broadcasts essential information regarding safety, health, and emergency preparedness, including information from the Commonwealth and our neighboring counties. We also broadcast our weekly press briefings on these stations. You can listen live on your computer or device at www.moncopa.org/Ready Radio, in addition to several nearby radio stations for free. And these stations include 106.5 FM WRDY in Eagleville, 105.7 FM WEMA in Marlboro, 92.9 FM WEMK in Upper Gwinnett and Lansdale, 92.1 WEMQ in Horsham and Fort Washington, and 105.7 WEMZ in Plymouth. And that concludes my report, Val.
Thank you, Ken. And I also just want to acknowledge the storm out there. It's really beautiful, but the snow is also wet and heavy. So if your power goes out, please report the outage to your power supplier. And we've got the number up on the screens right now of the 3 companies that supply electricity here in Montgomery County. Please do not call 911 unless you have an emergency. Our 911 calls, our telecommunicators get inundated during big storms like this. So this is one thing that we can make sure you don't call them for. Please do call your power supplier. And it's going to get nasty out there tonight, so please don't travel in this weather unless absolutely necessary. Stay home and stay safe. So with that, our next virtual meeting will be Wednesday, the 23rd of December, and I'll be happy to take questions.
Thanks, Commissioner. We'll start our questions this afternoon with Jim Melwick from KYW.
Your favorite topic, restaurants and gyms. Understanding the nature of restaurants and gyms make them significant spreaders. but they've been operating at capacity limits for months, yet the evidence to close them continues to be studies that, correct me if I'm wrong, all appear to be done before those occupancy guidelines were put in place. And it's my understanding there's no evidence of widespread transmission in a restaurant or gym in Montgomery County. My question is, if there's still significant sources of spread, wouldn't there be records of more recent widespread transmission? Again, recent meaning during those occupancy restrictions.
Yeah. So, good question, Jim. So here in Montgomery County, our contact tracers, when we were contacting, trying to contact everybody, did ask specifically about every place that any individual could remember being for the 2 weeks before. Well, it all depended when they were tested, when their symptoms started, but for some number of days, usually 3 to 4 days before their symptoms started, or they know that they were exposed. So we were not able to find transmission in gyms, and we had almost no transmission in restaurants. Most of the transmission that we saw in restaurants was between employees or staff of the restaurant, not so much from employees to patrons. The one important sort of asterisk to that, though, is that even when we were able to actually try to reach every person that tested positive, in our best efforts, we reached 68 to 70% of the individuals that tested positive. So we don't have information about that other 35%. And so I can tell you that with the people that we reached, we did not see significant spread in those locations, but we were never able to reach everybody.
So I don't mean to argue for or against, but we're hearing from the restaurant lobby and from gym owners that they feel that they're unfairly targeted, and I know the response from the state has been, well, it's the virus, not the government, but it does seem of all businesses that are addressed in this, it seems that restaurants and gyms are the ones that are top of the list.
Well, as you know, this is an order that came from the Pennsylvania Department of Health and from Governor Wolf. And so you really have to ask them about their thinking behind this order.
I have, and that's why I'm asking you. Sledding hills can get pretty crowded on a day like this. Is there any advice to people heading out to those sledding hills or heading out to play in the snow as far as COVID-19 is concerned?
Wear your mask, Jim, and be 6 feet away from other sledders.
Thank you, Ken. And I would just remind people that this virus stays airborne longer in the cold air. So just because you're outside, you still need to have a mask on.
I'm good, Todd. Thanks. And thank you, Ken, for being so succinct.
Thanks, Jim. Next, we'll go to Davin Jurgensen from WFMZ.
Hi, everybody. I am good. I just have a clarification question because I was typing like crazy. When you had said, Val, regarding the decrease of the prison from 1,342 to 794, what is that decrease from? Is that from just letting people, like pushing people out, like who can get out, to decrease the prison system? Is that what it's from?
So when the president judge issued his initial order back in March when the pandemic started, the courts worked very closely with the district attorney and the public defender's office to first release anybody who was in the correctional facility because they could not make bail, pay their cash bail. So a number of people who were there awaiting trial were released. Then there was the next cohort was made up of individuals who were nearly done serving their prescribed sentence. And so, if they were within days or weeks, they were released early. And then there were others, so as time went on and more people got closer to their release date, people were released. So there was a real effort to release anyone who could be released while always keeping the safety of the community top of mind as well. And then there's been a big reduction in new commits coming in. So we've already been moving toward a system of a pretrial services department in the county and an effort to reduce cash bail. And so sort of a hybrid of that system was implemented to try to make sure that no one went into the correctional facility simply because they couldn't make bail. And the president judge also ordered the magisterial district justices to apply the least restrictive sentence on anyone who was before them. Again, with the goal being to try to keep as many people out of jail as possible while still balancing the public safety.
Perfect. Thank you so much. I appreciate it.
Mm-hmm.
Our next reporter will be Todd Shepard from the Delaware Valley Journal.
Commissioners, thanks as always for doing the weekly update. Commissioner Arkush, since you talked about the vaccine distribution and the hierarchy, could you refresh me, please, where prisons are in that hierarchy? And supposing things did get worse at the correctional facility, do you have the autonomy and do you have the powers to maybe move them up the list? And as you answer that, if you could, sort of answer those specifically to the jail staff and then the inmates.
Yeah. So those are two questions that I have asked myself and don't have a full answer on yet. We would like to put both of those groups, both the staff at the correctional facility as well as the inmates, pretty high on that priority list. But it isn't clear to us yet how much autonomy we will have here at the county level once we start getting our vaccines. So if I can, once I eventually do get clarity to that answer, happy to share that answer with you, but I don't have an answer on that today.
Okay. And just wanted to see if you had any comment you would like to share on the lawsuit that was filed this week where a group of parents sued the Hatboro-Horsham School District, trying to force more, trying to put an end to all virtual learning.
I don't have any comment on that lawsuit.
Great, thank you. No further questions from me. Thanks, everyone.
Next, we'll go to Carl Hassler from the Pottstown Mercury.
Good afternoon, Commissioners. The state has said that they had 97,500 doses of the vaccine to distribute statewide. Do you have any numbers on how many Montgomery County is going to receive of those doses? You said 8 of the 9 hospitals will be receiving some this week. Do you have a final number on how many doses you will actually be receiving?
I wish I did, but I don't. I don't have any numbers.
Okay, who decides that? The State Department of Health decides?
That's correct.
Okay, when might you find that out?
I suspect we'll start to hear something within the next several days, at least some indication of what we'll be getting in our first delivery, but haven't heard yet.
Okay, and who actually decides who gets the shots during this first phase at the hospitals? Is it the hospital administrators who will actually select those who are eligible to receive it?
Yeah. So I have some insight into what the hospitals are doing generally. I can't speak for the specific hospitals, but they have all shared their general plan, which is that they are prioritizing within their hospital individuals who work directly with COVID-19 patients and who also wish to be vaccinated.
Okay, thank you. That's all I have this afternoon.
Thanks, Carl.
Next, we'll hear from Ellie Silverman from the Philadelphia Inquirer.
Hi, Commissioners. Thanks for having this, as always. Just a clarification question because my Wi-Fi has been going in and out. I know that you said vaccine will be arriving at most Montgomery County hospitals this week. So do you know the day when, I guess, the first vaccine would be given to a hospital worker, or did that already start earlier this week?
You would have to check with each of the hospitals. They all but one told me that they are getting vaccine this week, I think mostly today or tomorrow. and then had plans to start giving it fairly soon after that. One hospital knew that they were not going to get anything till I think Monday, so that the very beginning of next week. But you'd have to reach out to them individually to get their actual plans.
Thank you.
You're welcome.
Thanks, Ellie. That concludes our first round of questions. I'll now invite the reporters that we have with us to either indicate via a raised hand in WebEx or by taking yourself off mute if you have any follow-up questions for the commissioners.
Todd Shepard with a quick follow-up.
Sure,
Go
Todd.
ahead.
Commissioner, so of the 8 hospitals, you say it's those 8 will expect to receive theirs today and tomorrow, and the 9th would get that Monday, just so I'm understanding.
I believe it was Monday. Yeah.
Okay, so by Monday, all 9 is the expectation, at least at this point.
That's the expectation. And I know there's been some assurances from the governor's office that they would make sure that regardless of this weather, that this vaccine got delivered. So hopefully that will be the case.
Excellent. Thank you.
Mhm.
Okay, no other reporters have indicated that they have any follow-up questions, so that concludes our questions for today.
Great. Thank you, everybody. Thank you, Sarah. And we will see you all next Wednesday.
Bye. Thank you.